Welcome back. Health and Human Services Secretary RFK Jr. launching a new initiative targeting the overuse of psychiatric drugs, especially in children. With nearly 17% of Americans on antidepressants, the new plan urges doctors to prioritize holistic care like exercise and nutrition instead. Fox Medical Team's Dr. Mike live with more on this shift in guidance. Dr. Mike, good morning. And this is a major push towards de-prescribing. So what are the risks and benefits of this new holistic approach?
Well, Bill, number one, most experts and I agree with this approach. The bottom line is I never just give a patient a pill. One, I have a discussion with them and we see if it's the right thing to do. Secondly, if I do prescribe an antidepressant, I always insist that they get talk therapy, psychotherapy with it, and everyone starting at day one should be taught and learn how important exercise, eating the right foods are, and enough sleep. So it's not just let's give you a pill, see you later. The problem is that a lot of people don't have access to mental health providers. And the other big issue is mental health can lead to significant problems like suicide and violent behavior, all of that. So it's not just going to go away in many cases with exercise and talk therapy. Some people need medication, but that's why you have people like me that guide you through the shark-infested waters of healthcare.
Okay,
bottom line, but I welcome this.
Let's just hypothetical this. If a young patient or a parent comes to you with mental health issues, mental health concerns, what would be your process in that situation?
Well, if it's a young child, you don't want to use medication unless you absolutely have to. And so my son had some anxiety. First thing I did, I got him involved with a psychotherapist to talk about things. We learned some cognitive behavioral therapy techniques, and he was fine. There are some kids who have significant depression or anxiety. That's a different story. And as a primary care provider, I generally will refer them to a psychiatrist and psychologist for more expert opinion and treatment. That's what I do in my practice.
Dr. Mike, it is always a pleasure to have you, sir. Thank you so much for your perspective on this.